The short answer is yes. We have understood VOD and the context of VOD, and it's so important that because of the significant morbidity and mortality associated with the procedure, we need to be sure that we are picking out every case of VOD at its earliest sign of presentation. At the present moment, with the modified, with the Seattle and the modified Baltimore criteria that we have, we do pick out patients, most patients in most instances, but sometimes you have to wait for a certain threshold before they cross the barrier with either bilirubin levels rising or symptomatic presentation with ascites and abdominal pain before we embark on treatment. And there's this thinking that, we ought to look at all of the clinical pathological correlates, including biochemical tests, alongside the clinical presentation, and have perhaps a more broader overview so as to not miss any patient getting a diagnosis of VOD past a certain stage when you can institute treatment. So the revision and criteria should be more along the lines of being able to pick out patients earlier so that you can start treatment earlier, because we all know that VOD, the earlier you start treatment, the better the outcomes are. So I think this needs a collaborative approach across various centers across the world, where we can input through various stem cell registry, transplant data registries, to see how we can further refine diagnostic criteria for VOD.